Hi, this is Dr. David Kim. If you're thinking about getting pregnant in the next year or two, whether or not you have a partner, whether or not you have plans that are firmly in place or not, there's a lot of things that you can do to start taking action now to optimize your fertility, your physical health, and your emotional health. The first thing that's obvious to do is make an appointment to see your OBGYN. There's a few things that your OBGYN can help with is, one, looking at your medical history and your family history. You want to have your medical history evaluated in case you have some conditions that can be managed now to optimize your health. They can be medical conditions such as diabetes or prediabetes, high blood pressure, PCOS, endometriosis. A lot of these conditions can be managed beforehand to optimize your chance of getting pregnant and to have a healthy pregnancy. Secondly, it'd be really important to take a look at your family history and also your risks of different types of genetic diseases. There are blood tests that can be done, which I usually recommend, which is checking for genetic carrier testing. So you can check for somewhere between 400 to 500 different genetic diseases to see if you're a carrier of any of these genetic diseases. And a lot of people are, and that's okay. But then you want your partner to be tested to be sure that you guys don't overlap on the same genetic mutation, because in those conditions you'll want to have some strategy and consultation with a genetic counselor. Some other things to consider are getting a pelvic ultrasound. The reason why that's helpful is sometimes there can be some anatomic conditions such as fibroids or polyps that might interfere with getting pregnant in the first place, and those are things that you'd want to manage beforehand that sometimes can be taken care of to improve your chances of getting pregnant. And some of these things need some time. Surgeries would need some time for your uterus to heal in order to get pregnant. I think also some other blood tests to make sure you're immune to different types of infectious diseases such as rubella and varicella, which is chickenpox, because these are vaccines that we can't give to you in pregnancy, but if you're not immune and you're pregnant and you get exposed to someone with these type of infectious diseases, it can be very detrimental to the pregnancy. Another step that you can take is starting different types of appropriate supplements. One supplement that's really helpful is making sure that you're getting enough folic acid, which is 400 micrograms a day. Now you can get that in prenatal vitamins, you can get that in regular vitamins, you can just also make sure that you eat very healthy. Some other nutrients that consider would be vitamin D and iron and calcium if you're deficient in any of those things. You might want to consider also CoQ10 supplement. Now, interestingly, CoQ10 has been looked at in a few situations, and in animal studies where they looked at mice. Interestingly, they did a study in Turkey where they looked at mice, and then they gave one group of mice cisplatin, which is a chemotherapeutic agent that will damage ovaries and the DNA in the ovaries. And then they gave another group of mice the cisplatin and also gave CoQ10 supplement. In the third mice, they just left them alone, and that was the control group. So I think one of the reasons why they picked cisplatin, a chemotherapeutic agent, because they were then able to see the damage done to the ovaries and to see if there's some protective effect of CoQ10. And when they went ahead and did the study, interestingly enough, the mice that had the CoQ10 supplement with the cisplatin actually had higher functioning ovaries. There was higher AMH levels and higher antral follicle counts compared to the cisplatin group that did not have the CoQ10. Now, of course, the control group that had no intervention, no damage from the chemotherapeutic agent, had the highest level of AMH and antral follicle count. Now, what is CoQ10? CoQ10 is a natural occurring antioxidant formed in the body that protects against free radicals. Over time, as you age, the CoQ10 levels decrease. And then also, if you're on statin drugs, that can also lower CoQ10 levels. In human studies, there's not necessarily been a lot of human studies in CoQ10, but there are several studies that have looked at CoQ10 and IVF. They looked at different groups of IVF patients, and they gave them placebo or CoQ10. And interestingly enough, the IVF patients that had CoQ10 had higher rates of pregnancy. They also looked at IVF patients that had PCOS, and in those patients they found that there were more mature antral follicles in the patients getting CoQ10 compared to the placebo group. Now, there are some patients who are not very good responders to the gonadotropins. Those are the medications that are given for IVF to cause stimulation of the ovaries. Interestingly enough, in those particular group of patients that got CoQ10, they actually needed less medication and dosages of the gonadotropins to achieve successful IVF. I think because CoQ10 has very low risk to it, and because there's some evidence in animal studies and some evidence in IVF studies that seems to show a benefit in taking it, I would recommend taking it, and you can start that as early as whenever you're thinking about getting pregnant. Another special consideration is if you have polycystic ovarian syndrome. In cases with polycystic ovarian syndrome, you may want to consider taking inositol supplement. Inositol supplement is something that helps with the insulin regulation and also seems to help with ovarian health. If you have PCOS, you may want to consider taking inositol supplement. In 2003, the International Evidence-Based Guideline for Assessment of Management of PCOS recommended giving inositol to patients with PCOS. Now, there's not a lot of human data to show that there's a huge benefit from it, but the reason why in this paper that they recommended it is because there's such a low downside and low risk to it that there is some benefit to inositol that's been found in terms of PCOS symptoms, and there is thought that it could improve the degree of insulin resistance that exists, and so that's why it was recommended to take inositol supplement. But because there's not a lot of studies, there's not a lot of data to show which kind of inositol and which dosage of inositol to take. Thirdly, it's helpful to maintain a good lifestyle includes a healthy diet. Anything that is involved in just creating a healthy diet, well balanced for yourself in general, will be helpful for pregnancy in the future. I usually recommend having a Mediterranean diet with lean meats and proteins and nuts and vegetables. I would avoid a lot of sugars. I would avoid any fatty foods, fried foods, fast foods, because all those things can lead to overweight. Exercising is also very good, and of course if you can exercise 3 times a week with a combination of aerobic and weightlifting exercise, all those things are very helpful to getting pregnant in the future. If you happen to be overweight or obese, you may want to consider some sort of active program to lose weight. I think if you're at barely overweight, which is a BMI of I'd say about 25 to 27, then I think just going on some degree of caloric restriction and active exercise will probably be enough for you. And even losing a few pounds can improve your fertility rate. Now, if you're over a BMI of 27, that's overweight up to before, or obese, that's BMI of over 30, probably I would recommend going on some sort of GLP agonist, such as semaglutide, the trade name is Wegovy, or tirzepatide, with the trade name being Zepbound. The reason being is once you're over weight of a BMI 27 or higher, you probably have some degree of an endocrine disorder, where there is some miscommunication happening between the brain, the stomach, and the rest of your gut and the fat cells. And we don't know enough of the science exactly how this dysregulation happening, but I treat this as almost like as if someone has diabetes or high blood pressure. It is a medical condition at this point. And from studies, they found that once you're over BMI 27 or you're obese, a BMI of 30, the chance of being able to sustain weight loss is probably less than 3%. And these are people exercising, eating well, with coaches and nurses calling them, and still the chances are only at about 3%. If you have some other medical conditions such as diabetes or PCOS, also I would recommend going on a GLP agonist. Now, you don't want to get pregnant while on a GLP agonist because that's contraindicated. But if we have about a year to 2 years to work with, we want to have a good 6 months time where we're trying to lose weight with the medications, and even losing a few pounds makes a huge difference. Being on the medications and then doing a 2-month washout means 2 months being off of the medication and then trying to get pregnant. I can guarantee you're going to have a much higher chance of getting pregnant, but also there's some other reasons to have the weight loss aside from just the having a successful pregnancy. It can actually help with a healthy pregnancy, because when you're overweight or obese, the risk of miscarriage is much higher, and certainly when you're obese, the risk of congenital anomalies, especially heart defects, increases by twice the amount. Exercising regularly, of course, goes without saying. And then additionally, if you're smoking or drinking alcohol, I would recommend completely stop smoking, because that will start affecting the ovarian reserve in the eggs you have and the fertility chances that you have, and then also reducing the alcohol intake that you have will make for a healthier lifestyle. Fourthly, I think monitoring your fertility can be helpful. Some simple things you can do at home is just using some sort of app to track your monthly cycles. If you're having monthly cycles, then probably you're ovulating regularly. But if you're not having monthly cycles, I would do a urine ovulation kit. That will give you some idea of when you're ovulating and how frequently you're ovulating. You may want to use the urine ovulation kit anyway, just to get an idea of actually when your ovulation time is. You don't have to do this for an entire year. You can just do this for a few cycles. Next, you want to assess your fertility by when you see your OBGYN. If you're not having regular cycles, if your cycles are regular or if your cycles are really heavy or you go through months without having a cycle, it might be helpful to get an AMH level, FSH level, and estradiol level. The reason being is if you're having some degree of early premature ovarian insufficiency or you're just not ovulating regularly, some of these hormones can give us an idea if it might be helpful to consider seeing a fertility specialist early, or perhaps even doing some degree of egg freezing, or for any kind of future fertility planning. Fifth, reducing your stress is really important. This can be done by exercise, but it can also do by exercise and mindfulness and maybe yoga. And this can make a huge difference also. People that are constant stress, that are not sleeping enough, these women are going to find it a lot harder to get pregnant. It's going to take a much longer time. And some people, this is the sole reason why they can't get pregnant. When you have high levels of stress hormones, that will affect your fertility and your ovulation. And number 6, consider your environment. If you happen to work in an environment that has a lot of toxins and chemicals, these are things you just might want to be aware of. Consider if you can start changing the role in your workplace where you can be out of these sorts of environments. Workplace safety in general is something to consider in terms of the amount of stress or harmful substances you might be exposed to. 7, considering having good mental health and healthy relationships is also helpful. In preparing for pregnancy or future pregnancy, working out any type of relationship or mental health issues I think is very important, because when in the process of getting pregnant, the process of pregnancy itself and having a baby is so stressful, you'll want to work out with your partner any type of relationship issues or things that can make your relationship healthy. Having a 1 to 2 year process to work on that would be really great in developing a roadmap for that. Number 8, something I think that couples don't think about is planning financially. If you're a fortunate couple and you don't need to do IVF or fertility treatment, that's wonderful. But you may want to consider that possibility. And some of the things you can start doing now is looking to see if your workplace has some additional fertility riders to the insurance, and maybe they can cover some degree of fertility treatment, fertility drugs, or just consultation with a fertility specialist. If they don't, and if you're not happy with your job, maybe consider changing jobs to a job that does provide these benefits. And having this ready and prepared is really helpful. You may want to look at the quality of health insurance you have. Just because you've been single and healthy, or maybe you're married and healthy, you haven't had to think about the health insurance issue too much, but maybe you want to move to a health insurance that might give you a greater range in your network to see other physicians and specialists that might be helpful for your fertility planning. The other thing is just saving up enough money. Getting pregnant, being pregnant, having a family is very expensive, and sometimes just considering saving up for these things, whether it's just having improved savings, changing your lifestyle in a way to accommodate having a child, is really helpful. I know it's really early to think about, but if you're thinking about getting pregnant, you can also open up a 529, which is an account to help save for college. I know this is getting really early, but the longer you have your money invested, the easier it is in terms of college savings for your child. Lastly, number 9, you want to consider your fertility timeline, whether it's 6 months, 1 year, 2 years, and this way you can start thinking about the roadmap, getting your appointment with your doctor, just sort of having some rough plan in place. I don't think it's helpful to stress about it, but certainly it's helpful to be mindful and think about it. And thinking about these things ahead of time, talking to your doctor, talking to your partner, thinking about your job situation, I think all these things, putting it into an overall roadmap is something that will help limit stress later on. I think also getting the chance to think about these things, discovering if you're going to need something like fertility specialists, egg freezing, or further medical planning and treatment from the discovery along the way is something that's also really helpful. And being able to bring up these issues with your OBGYN, I think just creates that ongoing discussion, which is really helpful. Also, depending where you live, you might find that it takes a while to schedule an appointment with your OBGYN. In some places, it might take 3 to 4 months. So even if you were to schedule now, you may not even be able to see your doctor for 3 to 4 months. So just all things to consider. Certainly none of this is meant to be comprehensive, and none of this is meant to create stress for you, but really as a way to empower your future desires and goals and planning. Again, this is Dr. David Kim, and please put in comments if you have any other questions or concerns. This video is not meant to be medical advice, but certainly meant to be educational. And if it's helpful, please give it a like and also subscribe.